Good evening, everybody. Thank you so much for joining us today. Welcome to Innovating Healthcare, Lifestyle Medicine as the Future of Chronic Disease Management. What if I told you that one of the most innovative breakthroughs in medicine might not come from advanced medication, procedure, or technology, but rather through the daily lifestyle choices we make? That's precisely what we will be exploring in this session. So, in a world where chronic diseases are increasingly prevalent, we'll talk about how lifestyle medicine is emerging as a powerful evidence-based approach for not just prevention for chronic diseases, but also for managing and potentially putting these conditions into remission. My name is Rasari, and I am a vice president of the Sri Lankan Society of Lifestyle Medicine. So the SLSLM, we are a community of healthcare professionals, doctors and allied health professionals dedicated to establishing lifestyle medicine as the primary therapeutic approach for managing chronic non-communicable diseases in our country. We strive to ensure evidence-based practice in the field of lifestyle medicine while creating practice-based evidence. So today, as your moderator, along with Dr. Raida, who I will be introducing in a bit, I'm very excited to guide you through discussions with lifestyle medicine physicians and professionals in Sri Lanka. So we will explore the current health crisis, what lifestyle medicine is, the evidence for its effectiveness, its development in Sri Lanka, what's going on here, as well as the path to certification internationally. So whether you're a doctor, allied health professional, nurse, researcher, public health specialist, or someone passionate about innovative approaches to health, this webinar will definitely give you something to think about. So right before we get started, a few house rules to make sure we create an engaging and productive, safe environment for everyone. So please keep your microphone muted to minimize background noise. The board, please help with muting participants. Feel free to drop your questions in the chat feature while the presentations are going on. We encourage you to keep your cameras on during the session if possible. We like to see you. Please be respectful and professional in all interactions. So now let's begin our session. So I would like to introduce to you our first speaker, Dr. Rukshani. So this is Dr. Rukshani De Silva. She's a board-certified consultant in general internal medicine from Sri Lanka with over 5 years of experience as a specialist. She completed her postgraduate training in acute and general medicine at the John Radcliffe Hospital in Oxford, United Kingdom. She's very passionate about lifestyle interventions for chronic disease management. She specializes in personalized care for metabolic diseases. She has a specialist certificate in endocrinology and diabetes as well, and in integrating the key pillars of lifestyle medicine in her practice. She currently serves as the secretary of the Sri Lankan Society of Lifestyle Medicine. She has been an active member since its inception, championing its vision and mission. Her dedication to the SLSLM has been unwavering, and she has also contributed as the editor for Society's newsletter and continues to serve in its editorial team. Ruki, very, very happy to introduce you. Over to you.
Thank you, Rasari. First of all, I would like to know whether I can be heard clearly and also see in my screen can be seen.
I can see you. We are yet to see your slides.
Okay. Thank you, Rasari, for that kind introduction. And I'm really delighted to speak to you all today on a very timely topic that I am very passionate about, and I hope you will find this session very insightful. Chronic diseases, non-communicable diseases, lifestyle diseases, whatever you call it, is a growing problem in our country as well as globally. And in the next 20 minutes, I hope to provide the foundation to understand why we need a different approach in how we manage these conditions. So just talking about what non-communicable diseases are, stemming from the word communicable disease, we understand that that means diseases that are transmitted from person to person. However, so non-communicable diseases are diseases that are not transmitted directly, but they are a very complex disease conditions which are arising from the interaction of multiple risk factors and are generally slowly progressive and also generally last the lifetime of a person. And if you talk about NCDs, we do talk about four main diseases, mainly because they are the most common ones that contribute to mortality and morbidity. And those are cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes. Of course, the story doesn't end there. There are many other NCDs, some that act as risk factors for the diseases that I mentioned, like hypertension, dyslipidemia, and obesity. And there are certain autoimmune conditions as well as degenerative conditions that are part and parcel of this group of disorders. So just to talk a little bit of statistics to give a focus on how bigger the burden is, we know that non-communicable diseases have become the leading cause of death since the 1950s and still stands as the leading cause of death, despite many advances in, as Rosari mentioned, advances in medication, screening and diagnosis, and even monitoring. We haven't really able to make a significant difference in the impact it has made on our health and health of main populations. Now we know the success story in communicable diseases where, with many public health interventions like vaccination, hand hygiene, and water sanitation, we were able to bring it down to a comfortable level. However, that is not the case with non-communicable diseases. Unfortunately, we are still seeing a significant proportion of patients being affected. Now, if you take a look at this graph, you can see over the last 40 years, the number of deaths have doubled. And even despite the pandemic, we do see it contributing to as one of the leading causes of death in the world. And one of the reasons for this is, of course, the aging population. Although the life expectancy is increasing, it is not the case when it comes to the health span of a patient, where many patients are losing valuable, healthy life years because being affected by these diseases. And fertility rates are coming down, so we have a shrinking labor population and more patients who are suffering from and being impacted by the complications of these diseases. So this is something that we need to take seriously. And if you take a look at Sri Lanka, the case is the same, if not worse. Sri Lanka is affected with significant proportion of NCDs, and it is having a major impact on our economic situation as well. So if you look at what NCDs are causing the most trouble, I would say the cardiovascular diseases comes as number one. So those are your ischemic heart disease, your strokes, and other vascular disorders. And coming close at second would be cancers and chronic respiratory diseases. Diabetes and chronic kidney disease are also significantly affecting these numbers. And altogether, if you take Sri Lanka, even post-pandemic data shows that ischemic heart disease and stroke are one of the leading causes of death. And this is just to show the difference in females and males. Although males are more, what we know is that males are more susceptible to mainly cardiovascular diseases, but even females are significantly affected, especially hypertension and stroke risks are very high, and this causes significant morbidity and mortality. Why are we so worried? Yes, there are a lot of deaths, but that is not the only case. So why we are concerned is because number one is NCDs are giving rise to more premature deaths. So according to the WHO statistics, 85% of premature deaths, that are deaths falling between the ages of 30 and 70 years of age, are occurring in low middle income countries like Sri Lanka. And if you take Sri Lankan statistics, 1 in 7 persons are likely to die before the age of 70. So this is quite a sad situation, which can affect our parents, our loved ones, and something that we need to take seriously. And if you express it in what we call disability adjusted life years, or that is the amount of healthy years that are lost due to disability or premature death, this is significant. About 77% is contributed by these NCDs. And as I said, the economic impact is profound. So they say that 1.9% of our GDP is spent on cardiovascular disease alone. And that is more than 50% of our total GDP. So what that says is that many of these patients have to spend out of pocket to manage these conditions. And that is not sustainable for our healthcare system. And also this drives poverty, which in turn drives these NCDs even greater. So obviously, everybody can understand that we need to have a change or a shift of mindset as to how we approach these conditions. Previously, it was mainly about managing the symptoms, sequelae of these conditions. But now globally, everybody is recognizing that we need to look at the root causes of these conditions. And as I said earlier, it's a complex interaction between multiple domains of risk factors like genetic causes, things in the environment, physiological conditions like your age, gender, and behavioral factors that all contribute to the pathogenesis and the trajectory of these diseases. Now, WHO has recognized a couple of risk factors as one of the main modifiable risk factors that attribute to these diseases. And why I mention this here is because these are the risk factors that we target when we talk about lifestyle medicine. And those are unhealthy diet and nutrition, tobacco use, physical inactivity, alcohol use, stress, and mental health. It's all parts and parcel of
2 minutes ਹੋਏ
risk factors that gives rise to these NCDs. And also air pollution is a main risk factor, mainly when it comes to chronic respiratory conditions and things like dementia, which are also there are certain things that we can do to improve our environment and reduce the exposures. So this article actually gives a nice breakdown of the risk factors, but what I want to point is there are certain risk factors that can be modified. For example, your behavioral factors can be modified. Your environmental exposures can be modified. And of course, there are certain lifestyle factors that affect your epigenetic changes in your genome or DNA that affects your susceptibility to these diseases, and those can be modified as well. So there are certain areas that we can actually win this losing battle. In this slide, I just wanted to give you a highlight about the weight of each risk factor when it comes to the mortality. Smoking, high blood sugar, exposure to high sodium, fruits, diets that are deficient in fruits and whole grains, all of these have significant impact on your mortality due to NCDs. And mainly high blood pressure, which is something that is significantly affecting the deaths and the morbidity of due to NCDs, especially in a country like Sri Lanka as well, is something that has multiple other behavioral factors that contribute to the increased risk of high blood pressure. So there is a sort of an overlap between these risk factors, but what I want to highlight is that modifying these risk factors means we are going to reduce the amount of deaths that these are causing. So this is something that we need to address systematically. So as I said earlier, how we approached NCDs, even during my training, was that we used to look at the tip of the iceberg, which is we used to handle the acute complications, the symptoms, and the sequelae of these NCDs, rather than addressing their root causes that led to these diseases. So what happens in that situation is that although you are treating the patient's acute condition, the endpoint or the outcome or the trajectory of these patients' conditions don't really change. And that can lead to devastating impact on the family and the patient and the overall community. So we need to focus on what is underneath or what is hidden, that is the root causes of diseases, as well as the social determinants of health, that is your education, your income, and your access to healthcare, which all are linked to how we manage NCDs. So let me come to the topic of lifestyle medicine. I'm sure some of you are aware about this topic, but it can be a new topic to some of you. So lifestyle medicine is a part of conventional medicine. So it's sort of like a branch of allopathic medicine. It is, if you give a definition, it's what we call the evidence-based practice of prescriptive lifestyle interventions in order to prevent, treat, and at times reverse these conditions that I spoke about. Now, lifestyle medicine is, as I said earlier, evidence-based. So which means the treatment has to be based on current updated data. So there are 6 pillars that we talk about in lifestyle medicine, and why these 6 pillars is because the evidence has pointed to these 6 pillars as the causes for most of the NCDs that I described earlier. So in the latest Global Burden of Disease publication, they do talk about risk factors that are specific to NCDs, and some of them are replicated in these pillars. So whole food plant predominant nutrition, where the specific emphasis on whole food, which is food that is directly coming from the natural sources without being processed. Emphasis on plant predominant, so less intake of red meats and which are high in salt and also identified as a carcinogen. Second pillar is the positive social connections, which my second speaker, Aruni, will describe more about the evidence regarding this. Avoidance of risky substances, stress management, regular physical activity, and restorative sleep. So these are 6 areas that together contribute to most of the NCDs and the deaths that I spoke of earlier. So that is why we try to address all 6. And then lifestyle medicine is not just about giving sort of a blanket list of things for patients to do, which we already do. We do give advices, but this is what is different is lifestyle medicine is about how to get your patient to achieve a sustainable behavior change. So that is the difference in the medicine or the science that we're talking about here. So lifestyle medicine is about how to assess a patient, lifestyle risk factors, how to understand which risk factors are impacting their current condition, because not all risk factors will affect them in the same way. And then how to bring the principles of behavioral science in order to initiate and engage them in behavioral change, and how to guide them through this process. So it's a bit different to just giving advice about lifestyle changes, and it needs continuous medical education. So it's not something that you can do and dust off, like do an exam and dust off, because it's if in order to be evidence-based, you need to have continuous education. So this is something that we want to get everyone inspired on, because we see the problem, because all this time we've been trying to mop the floor, but we've not tried to close the faucet that's causing the problem. So we really need to focus on where the problem is in order for us to achieve better success in these numbers. Just to wrap up, I also want to talk a bit about our society. Actually, Rasari gave a nice description of what we do. So as she said, we are a society composed of both physicians, allied health professionals, and our main goal is to basically establish lifestyle medicine to advance NCD management and reversal in Sri Lanka. To this effect, we have done a couple of things. Mainly, we are focused on education and training. So in this regard, we have conducted the first lifestyle medicine conference, and we are hoping to conduct the next one this year in September. And also we facilitate certification processes. Currently, we facilitate the International Board of Lifestyle Medicine exam. And also we conduct webinars, education programs to ensure that we provide the training and education. And also we were lucky enough to conduct the first medical undergraduate program in lifestyle medicine in Sabaragam University, which was quite a highlight. And we hope to continue this further and engage more more undergraduate faculties in this regard. We also partner with various organizations, Ministry of Health Sri Lanka, the Sri Lanka Medical Association, and other stakeholders in NCD care and prevention in Sri Lanka. And also we have established a preventive research center recently in order to facilitate the lack of local research in lifestyle behavior and participatory research. So it's something that is coming up, and we hope you all will, some who are interested in research will get engaged in that. And also we are looking to scale up. We want to expand our membership because obviously this is not something that can be practiced individually. It's a multidisciplinary process, and we need many hands to get things on the ground. And just to introduce about lifestyle medicine healthcare model, what I want to say is in our current setup, I mean, especially in the hospital setup, we know that it's quite a traffic of patients. There's no time for us to actually indulge in lengthy discussions about assessing their lifestyle and talking through the change process. So how we can introduce lifestyle medicine into our practice in Sri Lanka is through the method of group consultation. Group consultation is essentially, just to keep it short, is where you have multiple people's a cohort of people who are suffering from the same condition. It might be patients with hypertension or diabetes, obesity, or whatever the problem that they're coming with. You can put them together and then discuss through the assessment and the changes in lifestyle as a group while you're managing their acute problem as well. So this is something that can be done. I mean, unfortunately, it's not, we're not able to sort of cover it at length in this particular webinar. But if you are keen to know more, we are really happy to discuss as to how this can be done. And of course, the lifestyle medicine kind of is a hybrid model where you bring both the public health and the curative sectors together. So there should be partnership between these two sectors for us to actually achieve the things that we want to achieve. And also to mention that we are part of multiple organizations that are working towards lifestyle medicine based practices, including the World Lifestyle Medicine Organization, which is affiliated to the WHO, and which is kind of a international body of global representatives that are involved in accrediting and doing research and educational aspects of lifestyle medicine. And we are also in the executive committee of the Asian Lifestyle Medicine Council and also a sister organization of the Lifestyle Medicine Global Alliance. And we are collaborating with many local, many regional and other global lifestyle medicine organizations. This is just a handful of pictures that I put. But if you take most of the countries around the world, lifestyle medicine is being practiced. And of course, certification, there are multiple certifications. The International Board of Lifestyle Medicine is the main modality of certifying for this, um, certifying in lifestyle medicine, and that is being practiced all over the world, as you can see, with a lot of physicians and practitioners being certified. And we also have a distinguished advisory board, consisting of mainly public health and secondary and primary care physicians, helping us in guiding us in how to direct goals and mission. So I want to wrap up there, but I'm really happy to take questions maybe at the end. And if you are interested in knowing more, please do contact us. We will be giving out our contact details, and we would like to see you more in future webinars as well. Thank you for your patient listening. Over to you, Rasari.
Thank you so much, Ruki, for your presentation into the insights of chronic disease and what we're doing here in Sri Lanka. I would also like to mention the lifestyle medicine healthcare model. Very proud to say that we were able to present it to the Minister of Health early this year, and then conversations are underway. So as I see no questions in the chat, I would like to move on to our next speaker. Would you mind stopping sharing slides? And Dinili can help with the picture of our wonderful next speaker. Yes. So just about to introduce our very good friend. This is Dr. Aruni Malvatta. She's a clinical nutrition physician and board certified lifestyle medicine physician who currently serves as the consultant clinical nutrition physician at the National Institute of Infectious Diseases in Sri Lanka, known as IDH. She brings a robust academic and clinical background, having recently completed a fellowship in clinical nutrition and bariatric surgery, Rochester Regional Health in New York in the US. Her work focuses on integrating nutrition into lifestyle medicine to prevent and manage chronic conditions. She's actively involved in multiple research projects at Rochester Regional Health, New York, and Western Carolina University in the USA. She also serves as a visiting faculty member at Lankan University College in Malaysia, Sabaragama University in Sri Lanka, in the Postgraduate Institute of Medicine, as well as Faculty of Medicine, University of Colombo, where she shares her expertise with future healthcare professionals. She's currently, very interestingly, completing her certification in culinary medicine at the American College of Culinary Medicine, expanding her knowledge of the critical intersection between nutrition and culinary practices for health promotion. Over to you, Aruni.
Thank you very much for that wonderful introduction, Rosari. So let me share my slides. All right. Are the slides are visible?
Yes, Aruni, we can see.
All right. Okay. So we had a wonderful introduction from our lovely secretary, Dr. Rukshani. So we knew that it's a evidence-based new specialty which brought a different platform to the medical field. So I would start from there with to discuss the available data, which is very robust data we do have in the global platform. So the definition of lifestyle medicine is evidence-based. So all this evidence comes from the studies that is happening all over the world, and it is using intensive therapeutic lifestyle changes. I would just like to focus on this exact sentence. Intensive therapeutic lifestyle changes means it's little different from what you really do, exercises little bit here and there, or little bit of good nutritional eating. So it's not like that. It has to be going into a different threshold level. It has to be intensive. That's how you achieve the proper results. So as it is used as a primary modality to achieve the chronic disease benefits. Plus, if you have lost your health, you can restore that either. So these are the 6 pillars. So we do have a lot of evidence coming up through all these pillars. Actually, the difference is that these pillars are synergistically working in a one platform. So you have to just forget about compartmentalizing the medical specialities like, okay, this is medicine, surgery, likewise. So this should come like a single one platform where we have done enough studies in the global level, which I'm going to discuss in next few slides, where we had wonderful results in disease prevention, reversal, and health restoration. So this is our famous diabetes guideline. American College of American Diabetes Association. So we do use this guideline. So this is a pictorial depiction of the summary. So you can see that lifestyle modification and diabetes education are at the basal level, which is the foundation of this wonderful building. So this shows that this is the thing that is holding up all the other treatment strategies in one strong foundation. So it is not that the drugs are not important, other medical remedies are not important, but for them to be more successful and more beneficial, you really have to have a good, strong lifestyle base. So we are doing that, and we invite all other doctors and other healthcare professionals to hold hands to make these platforms strong in each and every patient who comes to you. Similarly, this is the hypertension guideline, the European Society we do use. And you can see then again, in the middle, the initiating the lifestyle intervention is hand in hand with the drug treatment. So then again, it is unforgettable. So you should not just deliver it in one sentence, okay, lifestyle, but it has its therapeutic intensivity, and you have to deliver it in the proper intensity, and proper gravity should be there when you deliver the knowledge. So the dyslipidemia guideline, very commonly used and very commonly seen most of the patients who comes to our medical clinics. So you can see each and every box do have lifestyle advice, lifestyle management, lifestyle changes. So it is unforgettable. So then again, no excuse, lifestyle is a must. So now the whole world is looking into the newest data of healthy food habits, where we were preaching from last 20 years as lifestyle physicians all over the world. But now all the guidelines are focusing on this NOVA classification, which is the recommended healthy eating habits, where the unprocessed and minimally processed food lies in the group 1, and the second group holds up the same food, that is unprocessed and natural food, which is cooked with the homemade culinary ingredients, so which is home cooked meals. So these first 2 categories are always recommended through the lifestyle friendly diet. So we do not recommend group 3 and 4, which has processed and ultra processed food, which is really causing a lot of chronic diseases and so many health hazards to our people. So these things were spoken long before in lifestyle medicine platforms and our arena. We were just very stringent with these recommendations, but now the whole world has put their heads into these strategies. So this is coming from China. We hear the different approach from China. They have thought of flipping the pyramid, already happening everywhere in the world, and on their own. So this is the tertiary care burden and the money that they're spending on the tertiary care. And they have also just noticed that public health promotion was not really done comparative to the tertiary care expenditure. So they have thought, okay, now it's time to flip this pyramid upside down. So it's wonderful. So the best way to do this is the synergistic practice on our 6 pillars. So this is a wonderful example for the future medical transformation. So this is coming from Mayo Clinic, USA. So they have thought about including lifestyle medicine strategies to their standards of care with regard to the disease management, which is very exciting, and we can take learn lessons from them. So I'm just focusing on the very first wonderful studies which brought our attention into the lifestyle medicine evidence. Here, the DPP trial, diabetes prevention program, which happens years ago. So they were using intensive lifestyle modification with low calorie, low fat diets, and they were just focusing on 7% waste reduction, and they noticed that it was great, and they were just, it was more beneficial with regard to and comparative to the metformin use that they have been doing. So this is very useful, cost effective, and side effects less therapeutic strategy. So that is which has its own halo over that wonderful study. So then again, this is with food, a famous Predimed trial, where the Mediterranean diet, one of our whole food plant-based diets, were tested in Mediterranean countries. So they have also noticed that major adverse cardiovascular endpoints were really improved with this whole food plant-based diet, and there are other strategies which comes in the lifestyle medicine platform. So this is another one, which again, where the controlled diets and fruits and vegetable usage has shown quite an interesting systolic blood pressure and diastolic blood pressure reduction, which is very impressive. So inter-heart study and the next one, inter-stroke study, somewhat similar and looking into the same kind of risk factors. And you can see that inter-heart study had looked at 9 risk factors, and which is the other one is looking at 10 risk factors. Most of them are lifestyle related. So this has seen very marked risk accumulated in people who were with bad lifestyle habits. So they have really understood, and they have just explained their results with regard to the lifestyle scenarios their patients had. So this is another great trial which just turned our heads around, where the lifestyle heart trial, which was done by the father of lifestyle medicine, Dr. Dean Ornish. He just practiced 4 wonderful strategies: low-fat diet, aerobic exercises, smoking cessation, and good psychological help out to the patient cohort that he was studying about. He was just following with intensive therapeutic lifestyle strategy for 1 year, and then again he just wanted his patients to practice those things on their own for the next 5 years, where he has seen they have reversed their already established coronary blocks. And this is how that they have explained the heart disease reversal with regard to the 50% less cardiac events and LDL reduction and the reduction of angina episodes as they were noted. So this is a quite new study, which is has focused on the physical activity. This physical activity, people who are very good with the recommendations and physically active, good active lifestyles, they had reduced cardiovascular problems and cardiorespiratory fitness, and they were just working over the inactive people. They were just showing off more fourfold reduction of heart diseases and coronary events. Social connectedness is something very important and one of the great pillars and single most and the independent risk factor of the longevity. So we would just advise to have a lot of good friends and good social platforms, because the longevity project, which is coming from the Harvard University, explains to us if you are really having good social relationships and good friend circle, you will have your non-communicable diseases risk very less. So that means this created happiness flows into a 3 generations of separations. That means your friends would benefit, friends would benefit, and their friends would benefit. Sometimes it will go in, the benefits will flow down to a person who you never know even, because this happiness which is created with good connections are that powerful and that important. So this is important, very important pillar in our 6 pillars. So I would really concern and impress on this social connectedness pillar. So at the same time, if you are not well connected socially, let's say that you are isolated, you are just with the loneliness epidemic, and you are just not having very good relationships around. So it's like they say they have just studied and they have noted that it's like the risk is similar to smoking 15 cigarettes per day. So it's quite dangerous, I believe. So this is something to think about twice, and to have good social connections and good friends around. So sleep is another important pillar in our lifestyle medicine arena. So this pillar, the disruption of sleep pillar, we do recommend 7 to 9 hours sleep for every adult. So if they are not getting that enough sleep, they might come up with a lot of cognitive problems. This is one of the studies that explained one of the randomized crossover trials, which explained that adolescents had cognition issues plus obesity with regard to the poor sleep. So there's no doubt the final conclusion is to bring all 6 pillars into one platform and practice synergistically and just differently, little bit intensivity should be to the recommended level. It is not like, okay, just doing some exercises whenever you can, just go for a sleep whenever you can, just do all your work and sleep if you have time. It is not like that. So just understanding and learning on these pillars only can direct you to practice all these pillars properly. Otherwise, you will just pick this and that from here and there and different social media platforms. It would not really help. This is important to learn properly about these each and every pillar, because the data is robust, data is global. As a very young society in the country, we are just blooming up at this point, we are we have already started our research with our preventive research center, but we are yet to come up with our own data, which we are really concerned about in the future. But we have enough data pouring over each and every pillar every day. So that's why you should learn continuously. This is actually keeping you very live, because this data is very active. Every day you will get something good about your lifestyle habits. And when you start practicing lifestyle medicine on your own as a self-management, self-care remedy, you will feel wonderful. So that's it. So it is important to practice all together in one platform. Thank you.
Thank you so much, Arani, for that very insightful presentation. So what I'm continuously hearing from you is lifestyle medicine is very dose dependent, and we need to reach a therapeutic dose in order for it to be effective. Right. So we're about halfway in our webinar. We have two very interesting sessions coming up. So next we are going to hand over to Raida, and she will take you through some of our practitioners and will give you a chance to hear what's happening in Sri Lanka. After that, Dr. Mufi, our VP of Education, will talk to you about the certification pathway. And at that point, you will get to know a very special promotion that is going to be presented to all of you wonderful attendees of our webinar today. So first, we'll move on to Dr. Raida. A bit about her. She's a medical graduate and certified nutritionist with a comprehensive background in weight management and dietetics, supplemented by an MSc in food and nutrition from the University of Pennsylvania. She also has a portfolio of specialized certifications, including a diploma from the International Board of Lifestyle Medicine, and is a precision nutrition certified coach. She has extensive experience in weight loss, lifestyle medicine, PCOS, autoimmune conditions, and she has led transformative nutritional coaching programs. And she is also a member, and she represents Sri Lanka at the Asian Lifestyle Medicine Council. Over to you, Ryan.
Thank you, Rasari, for that very kind introduction. First and foremost, can everyone hear me clearly?
Yes.
Oh, fantastic. Thank you. So, hi, everyone. I'm Raida, and I'm an MBBS qualified nutritionist and an IBLM diplomat. So a little bit around what I do. I currently practice in the private sector, and I'm also the director of digital assets for the Sri Lanka Society of Lifestyle Medicine and a country rep at the Asian Lifestyle Medicine Council. So interestingly, I've unknowingly actually personally practiced lifestyle medicine for many years before I even knew what it was called, both for myself and others. But it was only when I actually formally studied it that I saw how it could be structured. So almost like prescribing nutrition or physical activity in proper doses based on the patient's context. So for example, there was this 60-year-old female. She presented with, she was in obesity class 1, and she had Hashimoto's and diabetes. She was on 100 microns of thyroxine and 10 mg of EMPA. So at that time, she had an HbA1c of 8.5, high TPO levels, and also grade 1 fatty liver. She had also tried to lose weight several times by following several fad diets, but she was actually very unsuccessful as weight would be fluctuating. So she also had stress eating behaviors. She experienced brain fog, daytime sleepiness, teeth grinding. So she came with a lot of, issues, a lot of stressful factors as well. What we did was we actually first and foremost addressed her nutrition with a precision nutrition approach. So basically, we looked at her foods. We focused on anti-inflammatory, low FODMAP foods, foods that were high in fiber, and coupled with a moderate protein intake, which helped her with satiety. So then she started to see very gradual weight reduction. So that all went well, but it was only once we started addressing her stress, actually, that and her sleep hygiene, that we actually saw a reduction in other symptoms, like her stress eating behavior and teeth grinding that is often associated with Hashimoto's patients as well. So she was a very sedentary person. She had a very sedentary lifestyle. She didn't do any formal exercise. So we had to introduce it in gradual incremental doses. So we did it at her own pace, starting from short walks after meals and then sort of gradually increasing, then slowly changing it to treadmill walking and, to make her feel comfortable with the routine. So her outcome was pretty impressive because she ended up losing 20 kilos, getting to an HbA1c of 5.9, reducing her thyroxine down to 25, and actually reversing her fatty liver as well. So the outcome, I would say, speaks a lot, because that's what lifestyle medicine is about. It's about applying these lifestyle changes with structure, personalization, and a little bit of precision. So we're given the tools, of nutrition, movement, sleep, stress management, social connection, and avoiding harmful substances, and applying it in a way that is sustainable and that it works. So that's a little bit about, my practice as a lifestyle medicine professional. But I do know that we have some amazing speakers lined up who will also speak about their experience integrating lifestyle medicine into their practice. And we'll have a conversation with them right now. So our first panelist is Professor Chandima Madhuvikramatilaka. She's a lifestyle medicine physician and professor in biochemistry and human nutrition. As a former president of the Nutrition Society of Sri Lanka, she has been involved in research and many other institutional, national development and community services. She was the former chairperson to the Ethics Review Committee, Faculty of Medicine, University of Ruhuna. So she's been instrumental in integrating principles of lifestyle medicine into her practice. But most importantly, she's a pioneer because she has pioneered the creation of the University of Ruhuna Lifestyle Medicine Clinic at the faculty. And that is absolutely amazing. So we welcome you, Prof. Chandima. Can you hear me?
Yes, I can.
Hi, Professor Chandima. So could you tell us a little bit about what led you to integrate lifestyle medicine into your career and how lifestyle medicine truly changes the outcomes in your practice? Over to you.
Yeah, no, actually, what I have to tell is more of a story. Thank you for giving me this opportunity and for the kind introduction. Actually, I am new to the field. Towards the latter part of last year, I got to know about lifestyle medicine from Dr. Aruni. That was a life-changing kind of discussion we had. And then I got to know about the lifestyle medicine. Although I have been practicing that, as a new thing, I got to know the integrated kind of holistic approach in the chronic disease management after the discussion with Dr. Aruni. So then I started to learn about it, and I did the lifestyle medicine course, and I started practicing that, and I started creating the project of creating the lifestyle medicine clinic at the faculty, and that is still in the infancy period. But I think it's a very innovative kind of approach that we have started because it is the first clinic that we have started in the southern part of the country. And other than that, I must say I have been doing mentoring and counseling for medical undergraduates, and especially this behavior change component that I learned in the lifestyle medicine course was very important for me in the management of this counseling in the management of medical students and also patients, because what we were doing was especially the expert type of approach than the coaching type of approach when you manage the patient. When I learned this lifestyle medicine only, I started changing my practice. And other than that, I would say I exposed to a lot of new literature when I go through the course. So I managed to improve my teaching content. I was doing lectures on human nutrition and diabetes for medical undergraduates. So I changed the content based on what I have learned. And I think that was a huge impact on them, because although we have like reached the top part of our career, but it's all the time we should get updated, and that will have a huge impact on both undergraduate and postgraduate trainees that we are training. And the other thing, other than all, what I mostly what I admired is it was a life-changing opportunity for me to engage in lifestyle medicine, because for certain areas, although we have practiced nutrition and we have done physical activities, but after learning about lifestyle medicine, we have especially learned about this self-care, and with that learning, I have changed my whole lifestyle, allocating time for myself and allocating time for my family and my loved ones. So that has changed a lot. I wish that I have exposed to this earlier. Thanks to Mufi and Naruni, I think I have learned a lot, and that has changed my life a lot. Not only mine, but the people around me, my family, and my parents, and even my students. As I was telling you, when they come to me, they sometimes come with the stress. Although it is, they say it as stress, it's a combination of a lot of things. It's about nutrition, it's about having poor exercise, and also mostly it's poor relationships and the poor sleep. So with the exposure of lifestyle medicine, I think I have started a wonderful job at the faculty, uh, doing a holistic approach and better job, I think, with the patients as well as the students, because mostly we come across students. To be honest, I think I have started a new beginning with the exposure, and for the future, I think it'll going to be a very good field, having a lot of opportunities, because nowadays there are patients who are looking for non-pharmacological approach of disease management and reverse. They don't like to straight away go for the drugs. There are so non-pharmacological management options. To be honest and to be truthful to you, I have reversed now about 2 to 3 patients with diabetes and pre-diabetes. They are very patients who are very compliant. They came to me with self-referral. I think the credit should goes to Mufi and the Aruni and my group members who supported me and who directed me. Uh, I was the senior most person in the group. So even with that, I managed to do because of their support. I think it was a unique academic exposure for me, who is having inherent kind of I'm looking for knowledge, and so I have that inherent capacity or interest to learn new things. So I think lifestyle medicine is a very good area for all of us to do. I think if there are new members, it's better if all of you can join the society and join hands in the Lifestyle Medicine Society to make a bigger community. So we can do a good job in future, in years to come, to prevent and reverse and to treat non-communicable diseases in the country, which will reduce the healthcare burden a lot. Thank you so much.
Thank you so much, Professor Chandima. That was absolutely insightful. And it's amazing to see someone who is practicing it for herself while preaching it as well. So truly an example for us also to follow. Next, we have a speaker who is not just a doctor, but actually a true pioneer in the field of digital health. Dr. Dulmini Vikramanayaka, she has a dynamic, diverse background because she's a graduate of the Faculty of Medicine from the University of Colombo. And she also holds an MBA and a postgrad diploma in IT. So she brings together medicine, business, technology, and in a way that few others have. So over the past 15 years, she has co-founded multiple ventures. She has led teams delivering enterprise-level health tech solutions across the globe. She's also currently the co-founder of Nightingale Inc., an AI-powered health and wellness platform, which is based in the US. And most recently, she has added another milestone to her journey, completing her board certification in lifestyle medicine, which beautifully blends her commitment to evidence-based care with the potential of digital innovation. So Dr. Dulmini, welcome. Can you tell us, with your unique experience, at the intersection of clinical care, technology, entrepreneurship, how have you integrated lifestyle medicine into your work, especially through the digital health platforms like Nightingale?
Yes. So good evening, everyone. And Raida, thank you very much for that introduction. So I'll start off with a brief background about myself because mine is slightly different from the rest of the doctors here. So I began my entrepreneurial journey while I was still in the medical college as a medical student together with my husband. So he's also from the Colombo Medical Faculty, a doctor, and he led the way into these entrepreneurial ventures. And since then, like you said, I have been in innovation, technology, and digital health. So to answer your question, I'll tell you how like we crossed the path with lifestyle medicine. So my husband and I, together with our other co-founder, we have always shared a deep passion for preventive medicine.
Dr. Dulmini, you have muted yourself. We cannot hear. Yeah, okay. We can.
Till what point did you hear, Ryder? Or did you not hear at all?
No, just like 5 seconds ago. That's it.
All right. Okay. So where was I? Okay. So what I wanted to say was that we had seen this pattern with patients who seek our guidance, and also friends, family members, and even team members, our employees working with us. What we had felt was that people truly want to change. They wanted to feel better. They wanted to make better lifestyle, healthier choices, but they didn't know where to start and how to make it sustainable. So this, with our expertise in IT and also the medical background, this led us into co-founding Nightingale Inc., like you have mentioned. So it's basically a AI-powered health and wellness platform that is designed to be a wellness companion and to guide users and patients in their wellness journeys. But as we were building the platform, at one point we were thinking that there's a missing element. And the missing element was sort of like a deeper framework that tied everything together. So we were looking for this missing element, and we came across lifestyle medicine. And then we realized that lifestyle medicine, with the 6 pillars of lifestyle medicine, that it brought so much clarity and so much structure, these lifestyle medicine principles, especially because it comes with science-backed, research-backed, evidence-based, sustainable wellness models. So then what happened was we connected with Dr. Samandika and also Dr. Mufi, who was very, very sweet throughout the whole process. So so both of them encouraged us to pursue the board certification. And we felt this would really help us with this innovative platform that we were developing. So right now, Nightingale is at a very good stage. We have been selected to one of the top incubators in the US, and it is being developed. So I'm thankful, just like Dr. Madhu said, that it brought in so much for the platform that we are currently developing. And for those who are listening, I would like to just touch upon the IBLM, the certification preparation, just roughly so that you all get an idea. So I want to mention that the preparation, the materials that were provided, the online video lessons, and also the course content was very methodical and very meticulously arranged. And it sort of offered a very deep insight and a structured insight into all 6 pillars. Like I mentioned, everything is backed by landmark research and the latest scientific evidence. So this combination and clarity of this organization, I think, will help if the listeners are interested in pursuing. I can very well say that it will get you well prepared for the certification exam. So, so this is our unique story, but I know many of you here are in the clinical services, public health, or academic roles. So I feel, Raida, that the beauty of this field or this discipline is that it can be taken on to any domain where you work. And it not only as a credential, it can enhance your career. It definitely has a very meaningful impact. You can have a very much of a meaningful impact on also to reshape your own personal lives. To anyone considering the board certification, I can wholeheartedly say that it will not only be a milestone in your career, but also as a mindset shift that will stay with you forever. And I just want to add one thing at the end. Completing the certification last year was not only a milestone in our professional journey and building our platform to its current state, but it also had a massive impact on us as a family. And I have a very young daughter, and I believe that one of the the greatest, one of the most valuable gifts that I can actually give her is to instill this mindset that is in lifestyle medicine from younger days. I think that is what is missing with all the junk food, the processed food. Kids cannot do without it. So I have, as a mother, I intentionally integrate lifestyle medicine into bringing up my daughter as well. So having said that, to end my session, I'm thinking whether I have the time to show a 2-minute clip, Raida. What is the situation?
Can we actually move on to the next few sessions?
Sure,
and then doing that,
yes.
Everyone is more than welcome to actually, we've got quite a few doctors here who are lifestyle, practitioners and physicians who will also be there to hang around and chat. So we can definitely have your video at that point as well. But it was amazing to hear the personal and both the, professional impact that lifestyle medicine has had in your life. So thank you, Dulmini. Thank you so much for joining us as well. And now I'd like to pass it on to Dr. Mufida. So Dr. Mufi, she is our amazing Vice President of Education for the Sri Lanka Society of Lifestyle Medicine. She's a lifestyle medicine practitioner, a physician who's passionate about taking evidence-based practices beyond the clinic and into the community. She does a lot of engaging workshops, and also her passion is to educate the general public on how small sustainable changes can actually lead to better health outcomes. So Dr. Mufi, can you tell us a little bit, actually as the Vice President of Education, tell us a bit more about the IBLM exam that SLSLM helps to facilitate?
For sure. So I've got a little PowerPoint presentation. I'd be happy to start that. But is it visible, Ryder?
Yes, it is.
Right. Okay. Great. Good evening, everyone. Thank you very much for joining us on this Friday evening and sticking with us as well. So as you heard, our practitioners and our physicians speak about this IBLM exam. I'd like to talk to you through the process of it. So what is IBLM? So IBLM stands for the International Board of Lifestyle Medicine. It is an organization affiliated with both the American College of Lifestyle Medicine and also the American Board of Lifestyle Medicine. And it is the organization that sets the global standards for credentialing physicians and allied health professionals in evidence-based lifestyle medicine. It is a diploma exam, and it's based mainly on the lifestyle medicine core competencies that were first published in the JAMA in 2010. The manual that comes with it is currently on its 4th edition. They're very good at updating it every 3 to 4 years. So whatever knowledge you gain is really what's top tier and what's new. Once certified in this exam is, as I mentioned, it is a diploma IBLM. So you will get the DIP IBLM post-nominal, which would reflect your advanced knowledge and skills. So now you've listened to everyone and you're still wondering why certify. So I'd just like to reiterate some of the things that our speakers spoke about. So things that are not what we are not taught in university in our undergraduate levels is mainly about the 6 pillars, about nutrition, physical activity, sleep, barely touched upon. So, and as Ruki and Aruni elaborated, these are the main causes of our NCDs. So certifying in this exam will give you a very good foundation on how you can learn, prevent, arrest, and reverse these non-communicable diseases using evidence-based treatment modalities. Having a certification, of course, will give you recognition by your employers, peers, and patients as having obtained specialized knowledge and skills. There is, if you look at this previous slide, and Ruki spoke about it as well, as you can see, there are many, many countries where people are doing it. So it'll help you join a global movement. And personally, our organization's vision is to have every Sri Lankan know what lifestyle medicine is and is to practice it as well. And like Dulmini said, and Prof. Chandima as well, my main things, like what I have really loved about it is the personal transformation. You'd experience these very positive changes in your own health and lifestyle habits. It really sort of seeps into your family and friends, and especially when it comes to work, the personal satisfaction levels that you have will really, really increase. Things of note, I just put this slide in here because we have many, many questions about these things, is that the diploma is issued and proctored by the International Board of Lifestyle Medicine. As the society, as the Sri Lankan society, all that we are doing is we are facilitating the exam. The certificate is, as we mentioned, it is a diploma certification, so it does not give you special registration. And this is also not a substitute for migration exam or qualifications. But we have had quite a few physicians who have done this and migrated because, of course, it helps give you an added benefit in your CV. So what is in the exam. To begin with, it gives you a very broad introduction of lifestyle medicine and what it is, and what are the main studies and research that builds a case for it. It then goes on to talk about the fundamentals of health behavior change. And as we know, as most of us would have had experience with patients, if not even patients, then family members. And we all know that health behavior change is what is the biggest challenge sometimes. So it really talks about the different theories of health behavior change and how it can be adapted. It also talks, then the next chapter is about the key clinical processes in lifestyle medicine. The fourth chapter of this book, I should have actually shown you, this is the manual that you get when you sign up for the exam. It talks about the role of the practitioner's personal health. So it really helps someone to combat physician burnout and community advocacy. The latter half of the book, of course, focuses on the 6 pillars, which is nutrition, physical activity, emotional well-being, sleep, managing addictions, and the role of connectedness and positive psychology. So what is the eligibility criteria for the exam? Binili will speak later about the costing of it, but because we have a special offer this year for eligibility criteria for both physicians and professionals, is that they have to be currently working in Sri Lanka. Physicians are required to hold either an MD or an MBBS and have registration from the SLMC. For professionals, it's anyone in an allied health discipline as specified here, like nursing, dentistry, pharmacy, physio. If you have a master's or a PhD, then you are eligible to apply for the diploma. Very importantly, I would like to mention that we are also, as a society, we are giving scholarships for this year. There's a limited number available. What we mainly want to see is that there are many, many people in Sri Lanka working towards lifestyle medicine. Even if it's not lifestyle medicine, they are working in the public health sector or in the ministry towards bettering health in that sort of atmosphere and in that sphere. So we would like if you could send in your essay and a CV with your academic records, and you can apply for the scholarship. Of very important note is that the deadline for the application is the 30th of April. So the exam, the prerequisites is that for both the physicians and the professionals is you have to do 30 hours of online non-CME material. So it's non-CME because it's given by the American College. It doesn't translate as CME for us, but it's 30 hours of online material from the ACLM, and that goes in concordance with this book. And once you go through the online platform, you will go through this book and multiple questionnaires, and then you will gather your knowledge with that. The other prerequisite for the exam for both physicians and professionals is also that one needs to attend an event from an approved Lifestyle Medicine Global Alliance Society. The Sri Lankan Society of Lifestyle Medicine is an approved society, and we are having our second Lifestyle Medicine Conference in September. And if one attends the conference for the 2.5 days, that will help you cover the 20 hours of event CME. For physicians, there is an added requirement of writing a case study. As a society, we will help you through that, but it's a very short case study of applying lifestyle medicine principles either on a patient or yourself, maybe, if not all, even some of the pillars, how it helped or how it didn't help, and what your reflections of that has been. The exam in itself will be on the 19th of September. It is a 4-hour exam. For physicians, there is 150 MCQs. For professionals, it's a 120 MCQ exam. You would be required to bring your own laptop or tablet in, and you can take it on the software. There's a proctor coming in from the US to proctor the exam. The results will be out on the 3rd week of December. because the exam, why so long, like from September to December, is, as I mentioned, it is a global exam. There are many people, thousands of people or many countries doing it. So they do grade it on a global scale. If one other question that a lot of people ask is that, do we have enough time to study for it? It is very doable. It is very doable. And IBLM in itself is trying to promote lifestyle medicine as much as possible. So it is on the grade. They do pass as many people who sit the exam as possible, and they do have a relatively average pass mark that can be passed quite easily. How would one study for this? So it is an exam that is a self-study. You'll have to do it on your own pace. But as a society, over the last few years, we have been helping as much as we can to facilitate our candidates or Sri Lankan candidates, even because every other year you would be sitting directly with IBLM, but we do try and help as much as possible. We have WhatsApp group chats with Q&A sessions. We also do Zoom online Q&A sessions. There are also a few MCQ banks out there available, and we have tried to go through them as much as possible as well. So that is what I have to say about the exam. And following this, I'm sure a lot of you have questions on what more can be done, like how does one register, what is the pricing of the exam. So for that, I would like to invite Dinili, our Sri Lankan Society consultant, on. So Dinili has, to give a brief introduction of Dinili has 20 years of experience in a wide spectrum of fields, including corporate banking, retail, coaching, training, and also mental health. She's an entrepreneur, a certified life coach, an NLP practitioner, and she is a lifestyle medicine advocate.
Wait, I'll tell you when to share the slide.
Her passion is to empower people by helping them learn vital skills that will better their lives. So Dinili, over to you.
Thank you, Dr. Mupi. I just want to quickly say actually as to why I became a lifestyle medicine advocate. In 2019, I was diagnosed with multiple sclerosis, an autoimmune nerve disorder, and faced many complications of paralysis and losing my speech completely. But I'm very happy to say that incorporating lifestyle medicine changes has helped me to manage my symptoms without using any disease-modifying therapies. A big thank you to Dr. Apita, who is with us here today, who prescribed lifestyle medicine changes for me and really turned my life around. So during this journey, I actually met some of the board members of the Sri Lankan Society of Lifestyle Medicine, who truly inspired me with their dedication and commitment towards this amazing cause of promoting lifestyle medicine in Sri Lanka. And that is what inspired me to join as a consultant to take on and carry forward the mission and the initiatives of the society. I'm sure all of you are waiting to see what is the promotion we have in store for all the webinar participants today to go ahead with the certification in lifestyle medicine. So actually, just to let you all know, there are a few different pathways to register for the IBLM certification. So one way is you can directly register with IBLM as an international student, or you can register with IBLM through the Sri Lankan Society of Lifestyle Medicine. So if you register directly with IBLM as an international student, the cost would be $1,800, amounting to 545,000 rupees. And please do note that conference costs are not included in that $1,800. But due to the great efforts of creating this society in Sri Lanka, we are, as a region and in Sri Lanka, able to offer this certification at $1,177, amounting to 360,000 rupees. And please do note that the conference costs are included in this amount. I think it's good to highlight as to why you all should consider registering in 2025. So our board members of the society has worked tirelessly with IBLM and got a very good and big grant from IBLM, which has enabled us to offer the first 40 registrations through the society at a special offer of $400, amounting to 120,000 rupees. And in this 120,000 rupees, the prerequisites that Dr. Mufi explained to you, the 30 hours of CME online course, as well as the 20 hours conference event is included as well. So we thought we have to do something special for our webinar participants today, because you all have been with us for 1.5 hours, attentively listening to all the speakers. For the webinar participants today, we will be giving a further special offer of a 10% discount, which makes the final price $360, amounting to 110,000 rupees. So the total saving for the webinar participants today would be $817, amounting to 250,000 rupees. I think that this is an amazing and huge saving. And I really urge and encourage each and every one of you to make use of this big saving and apply for this certification while the promotion lasts until the 4th of May 2025. And when you register, please use the promo code WP01. Also note that 25% advance amounting to 30,000 rupees is required to reserve your spot in the first 40 registrations. We already have about 10 participants who have registered so far for this first 40 offer. And I just also want to mention that payments towards the exam are non-refundable, cannot be cancelled or deferred. Just to quickly go through some additional benefits of getting this IBLM certification is that you are entitled to a 1-year membership of the American College of Lifestyle Medicine. So usually getting this 1-year membership would cost you annually $250. But as a benefit of the certification, this membership is there for 1 year complimentary. You will also receive a complimentary 1-year membership with the Sri Lankan Society of Lifestyle Medicine. We also have planned to create a certified practitioner listing on our society website, giving details of all those who have certified in Sri Lanka. And if anybody actually approaches the society and asks for practitioners who are promoting lifestyle medicine, we would be asking them to refer to this certified practitioner list. Some of you might not be able to register this year for the IBLM certification due to many reasons. And some allied health professionals, if you still do not have a master's qualification and unable to register for the certification right now, we really urge you all and encourage you all to join the force against non-communicable disease and to become a member of the Sri Lankan Society of Lifestyle Medicine. Because we hope to have many training programs, many interactions with our membership. There are 3 member categories, the physician category, the allied health professional category, and the student membership category. So if you are interested to become a member, please do contact us on this number or the email address shown on the slide. Thank you so much.